Hi, David here. Just wanted to kind of follow up back on one of the things that I think is really important to kind of take into consideration as we look back what's been happening with hospitals and some of the discussions around the preliminary budget for the health committee, the city council's health committee had regarding the new Department of Health and Mental Hygiene under Dr. Martin, the new health commissioner. Uh, some of the information that has been coming out of the Office of the Chief Medical Examiner and marinating on a lot of the news that's been coming out around Brooklyn Hospital and what I spoke about previously with Maimonides Hospital. Right now, we really have to take a really close look at the processes for how our healthcare systems work, and particularly for those of us who are not able to go to the hospitals in Manhattan and largely are getting care from safety net hospitals like Brooklyn Hospital, Brookdale, Kings County Downstate, Elmhurst, Queens Hospital. Um, you know, these all of these hospitals are share a lot of what I think is coming out of a lot of these discussions around um, a lot of the fears around the care that folks are able to receive. Right now, Brooklyn Hospital, even with the money that they received from Hochul, tens of millions of dollars from Hochul, to cover some of the gaps in funding that they needed to keep the doors open, was able to keep the hospital going, but the health insurance that the nurses who do the critical essential work of taking care of patients in their beds and whatnot do not have health insurance. When the nurses went on strike at Presbyterian in Mount Sinai and in Manhattan, several of the safety net nurses made it worked out an agreement with management at the private hospitals in the safety net system to agree to negotiate in the wake of what would come out of the nurses strike that happened earlier this year. What happened as a result, simply because Brooklyn hospitals didn't have the money, and you could maybe and you could take your own opinion about what the management at Brooklyn Hospital is looking to prioritize. But the nurses at Brooklyn Hospital have worked straight through and now don't have any health insurance. We can revisit the fact that Maimonides needed to be saved from its danger of being closed. And of course, we could talk about the cost of healthcare increasing, the cuts of HR1 that has put a huge burden not only on safety net hospital, but all our entire healthcare system, not only here in New York but across the country. And one of the things I think that is not talked about, you know, the first, it's a good thing that again Maimonides was able to get merged with health and hospitals and increase the reimbursement rates. But it's really important to remember that as for all of the improvements that health and hospitals has been able to make over the recent years, it still has a core issue that HR1 makes more clear, which is Medicaid reimbursement rates. When you have a population of patients who are largely on Medicaid, Medicare, one of the things that you begin to realize is that these services that are being supported by the federal government, the state government, these these insurances don't cover the full cost of care. So these hospitals that largely take care of vulnerable people, working families, low income, communities of color, folks who um, are largely on Medicaid, Medicare, and in these services are hospitals that primarily take care of these patient pools simply just don't have the money to complete costs for complete cover all the costs of care, and a lot of hospitals have to get very creative of how they're able to continue to provide services for folks. And again, we learned that public hospitals get higher reimbursement rates than private hospitals, but this is still a big issue, particularly for the private hospitals in this case, if they're not part of a big private system. And when we talk about the fact that Manhattan, the hospitals in Manhattan, Mount Sinai, NYU Langone, Northwell, Columbia, as we go down the list, when you look at the Lown Institute's breakdown of these hospitals, you realize that these hospitals are, and particularly in Manhattan, are largely segregated. It's actually the top 10 in the most segregated some of the most segregated places to get healthcare in the country, which is crazy. And a lot of this is powered by, again, this issue of Medicaid reimbursement rates. So one of the things I think that we have to take a look at as we really dig into the health inequities that are present in the system, and why is it that those of us who try to get care in the remaining hospitals in our neighborhoods, because we know you live in Southeast Queens, you live in certain parts of the Bronx, you live in certain parts of Brooklyn, you're kind of screwed when it comes to getting quick access to quality health care at some of the hospitals, because of how far away you have to travel to get to them. And one of the things that becomes very clear is that this core issue of Medicaid reimbursement rates is a major driver of some of these issues that we're seeing. Not exclusively. Medical racism, systemic racism, many of the breakdowns in funds and the disparities that we see that kind of find its way into the healthcare system are definitely greater than just this one issue. But it's one of the reasons why when folks talk about the New York Health Act or Medicare for All at the federal level, New York Health Act is the equivalent at the state level, that these are policies that do a huge amount of effort in fixing a lot of these major issues. And one of the things I want to hear from y'all is, as you guys, think about your own healthcare experience, or their stories of close loved ones, friends, families, those you may have seen, on social media, really think through, what do you think are the major drivers of this, and pay a little bit closer attention to what's happening. Obviously I'm here and out in the city, so I'm talking about the city hospitals, but this is not only just a city hospital issue. There's hospitals all across New York State, or if you live in another state, I'd like to hear about some of the experiences that you're having. Please put it in the chat. We're gonna dig in a bit more into some of the other hearings as we have some time to kind of really dig into what we're able to take away from them, and a little bit more about some of these experiences that folks are having. Maybe get a chance to share some of these other stories, but I want to hear from y'all.